So welcome everybody. My talk will be demonstrating the use of VEDMAP, which means Value and Evidence-Based Decision-Making and Practice Framework, as a tool for research tool for value mapping and value implementation fidelity assessment. This was used in the case of feasibility study we had on HEPU technology assessment in Malawi. As a background, we know that in HEPU technology assessment, somebody will come and explain what is HEPU technology assessment is. Institutionalization in Malawi is underway by government, and the significant milestones have been attained, including formulation of HEPU technology framework. Just like empirical evidence, values are so at the core of optimal decision-making in HEPU technology assessment, appraisals, and adoption. However, value proposition, value mapping, value alignment, and value fidelity assessment in various contexts require a systematic and robust mechanism. And we have seen that whereas evidence informs decision and policy-making, values influence implementation fidelity and professional behavior. So Malawi is well known to produce good policies, but weak in policy implementation. My assumption is lack of policy implementation fidelity could be due to lack of appropriate value mapping, proposition, utilization, fidelity, and monitoring. So the rationale, if you look at the MOH policies, strategic plans, you see a lot of guiding principles, guidelines, value system, underpinning effective implementation, including even 2063 has got value sets. Within a developing country context such as Malawi, HTA and adoption is sometimes characterized by political economies like conflict of interest, corruption, etc. And this can lead to suboptimal decision-making and HTA assessment adoptions. To guide a transparent and accountable, efficient, and equitable HTA process, value sets need to be identified and agreed upon. Across countries, in many countries, value sets exist, but their appropriateness and actualization and implementation is seldom assessed. HTA success depends on a great extent on alignment on what is actual, that is implemented values with normative values that have been agreed. So implementation and the M&E frameworks normally do not track value sets. They track other things, but not value. So why fidelity assessment? In practice, the values are used in which are implemented, usually differ from the ones which are agreed. So this may be because of lack of good leadership, corruption, weak governance system, or weak systems. From initial assessment of HTA value sets across countries, there's no shortage of having guiding principles. So we know everywhere, it's like a mantra, we've got a guiding principle. However, there's a lack of evidence on how they're being stated and mapped out, prioritized, and utilized. And whether or these discrepancies between the stated values and agreed values are being implemented. So I will talk about different types. To understand the VEDMAP, we need to understand different types of decision-making. There are two types of classical decision-making models in the world. According to VEDMAP, VEDMAP opposes or proposes that a human being cannot only make a decision based on evidence. Even politicians do not make a decision based on evidence, because demand and supply of evidence requires values which actually value evidence. So the conceptual framework has got 4 cornerstones, 4 levels. The first one is you do the value mapping of what is normative. This normative means what you have agreed. On the paper, you agreed these are the value sets of our organization or of that intervention. The second one is the determination of what is the actual implemented value. This is the values you use when you're at the point of making decision. The third one is what we call value fidelity assessment, where you compare between what is normative, what has been agreed, and what is being implemented, value sets which have been implemented. And with this, you can actually discover whether there's misalignment or alignment to your goal or context. And then you can come in the last page where you map out the appropriate values, what we call optimal values for optimal implementation. Next. So this implementation has got, fidelity assessment has got 4 pillars. The first one is motivation. What is the motivation of alignment, misalignment? The second one is we're enabling factors of alignment, misalignment. The third one is reinforcing factors of alignment, misalignment, and the outcome. Next. And we have discovered that this is a probability that the value alignment, misalignment determines fidelity and infidelity of implementation. For example, the higher the misalignment between what is agreed normative and what is actual implemented values leads to less likelihood of implementation. And the higher the alignment between what is been agreed and what is implemented lead to the higher likelihood of optimal implementation. Next, so the objective of this study, or overall objective, is to demonstrate feasibility of VEDMAP as a tool of value mapping, ranking, monitoring, fidelity assessment in HTA. The specific objective were to demonstrate the importance of integrating values with evidence, identifying normative values and actual values, establishing fidelity, assessing motivational, enabling, etc. Demonstrating how VEDMAP can be used as a monitoring and evaluation tool. However, I have to admit the third one, where we didn't look at motivation factors of misalignment and the enabling factor. Just look whether things are aligned or misaligned. So the methods were desk review, looking at the normative values which were being agreed in policy, etc., and in publications. And the second one was looking at having key informant, looking at the actual, interviewing people. What value sets are you using? And the third one was evaluate alignment and misalignment between normative and value using what we call fidelity assessment. The results, the tool was able to map out health technology assessment and adoption normative values sets for Malawi and beyond, because we also included other countries. It mapped out actual implemented value sets for Malawi. It managed to identify misalignment in EHP. Normative values and the actual values were not aligned. And the use of VEDMAP framework demonstrated its flexibility and user-friendliness that it can provide guidance on assessing and mapping values. Across the country, values we have seen that exist, but their appropriateness and evaluation and actualization are at SEDOM actually assessed and monitoring. One of the respondents answered this to show that there's misalignment. The recent revised essential health package not aligning with essential medicine risk and the standard treatment guidelines in policy implementation. Therefore, I quote, although there are value sets which define the EHP, the process of allowing that process to inform treatment and guidelines in essential medicine isn't inexistent now. So it's one way, the values are there, but I'm sure they are being translated into process that really inform what is procured. Conclusion, VEDMAP has demonstrated that its ability to be a reliable tool for value mapping and value implementation fidelity and tracking. The lack of appropriate value mapping and value fidelity monitoring and evaluation do lead to policy infidelity. Both evidence and value mapping are crucial for optimal decision making in HTA. Without appropriate values that value evidence, the best available evidence could be ignored at the point of implementation. Thank you.